So welcome very much for all of you that have taken time to listen to us and to hear about our launch of the CHAP, the Climate and Health Analytics Platform. The A could also be assessment platform. We'll come back to that later. So, the next. Sorry. So what we will talk about today is actually us presenting the climate and health digital tools that we are developing. And the CHAP, we would like to emphasize the CHAP that we are developing now in the DHIS2 style, a collaborative and open source platform for training, tuning, and assessing and sharing predictive models for climate-informed disease forecasting. And in order to do that, of course, we need to have access to climate data combined with health data, and that's also our focus in this webinar. So what we want to do is to provide capabilities to run and assess models using historical country data for feasibility studies in the countries. Of course, for us helping the countries, but this is a country kind of owned tool that we really want to, for the streamlining the country installation, make that easy. Configuration and use and comparison of models that could be possible to run in the country. So that's where the assessment comes in, not only ready-made analysis for prediction. It's integrated with the operational DHIS2 system in country through the prediction app. However, it can also be used with other systems than DHIS2. So it's kind of not DHIS2, it's agnostic towards which system the data is coming from. The aim of the CHAP is to provide countries with a learning platform that evolves through each implementation with these generic softwares that country can customize and feed back to the CHAP platform so it can evolve and be better and better. Next slide, please. We have an internal team that develops also models, modern machine learning models based on cutting-edge research, but also based on real-life data from countries. So we are working in close partnership with the countries we are piloting in order to be able to assess those models and improve the models. However, partners can also use CHAP to share their models with countries to see whether they are fitting better and what models would fit that geography and that real-life problems in a better way. We provide model bundling partner with a generic software that can be reused, because we have seen many modeling partners not really emphasizing on reusing the models and being improved over time in the DHIS2 style. Next, please. In the DHIS2 style is that we are actually leveraging upon all the DHIS2 adoption in the world to make tools on top of DHIS2 to be able to provide extra tools that can enhance the resilience of the health programs with climate data to be able then to do assessment, analytics on the climate impact on health and diseases, but also on prediction, and that is what we will emphasize today. We know that global DHIS2 is a global public good. CHAP is also a global public good, up there for grab. It's open source and it's free of licenses, and you can actually support every type of use of models. So that's the style of the DHIS2. Next slide. Of course, without the regional HISP groups, we wouldn't do anything. So everything what we do in the country, with the ministries, with the government, we do through and with all the HISP groups. You can see the whole list here. That's actually our critical component of the HISP approach. We wouldn't be here and we wouldn't have the implementation in over 80 countries using DHIS2 for the national HMIS system if it wasn't for the local regional HISP groups that provide long-term, lifelong support to the ministries, and they are a trusted partner. And that closeness to the field is also giving us a chance then to have the eyes and the ears to the field, and in order to be improving the global platform as in DHIS2, as in the CHAP. So we are doing the same style of development of the platform as we do with DHIS2. Next. That's why Wellcome Trust came to us. You are there having data in so many countries, And why don't we leverage that one in order to be able to expose, to do advocacy for developing tools, analytical tools on top of DHIS2 to provide a more resilient preparedness for climate changes in the future, but also present, even though the changes have changed, the climate impact on diseases, not necessarily a change. We don't care about the change necessarily, but dealing with the seasonality, with the increase of a rain period, or not knowing when the rainy period is coming. So we are then enhancing the existing DHIS2 system to support effective and timely analysis and decision-making in response to these climate-sensitive health risks by developing climate and health analytical tools and modeling tools, and also the design of visualization and dashboard to be able to visualize this and do advocacy for the health programs and help them. So this is what we will show you today. However, this is a 2 years proof of concept phase that are funded by Wellcome Trust. In order for us to win the next 6 year of grant to work with the countries, we need to show, of course, that we approved the concept. We think we already have done that, proudly present, sorry. However, we also need a matching fund from partners. We need to show that partners think this is important and for countries, in country, but also globally. And that is actually one of the things. So if anyone would like to collaborate with us in a country, please reach out. Next. Over to Björn.
Yes, so this is how we plan to extend DHIS2 to accommodate the climate and health field. You can see that there are 2 apps that you can soon install on your DHIS2 system. The climate app is already out and is used in production. The prediction app, which is the app that integrates with our modeling tooling, the CHAP core, will be available later, but you will see a demo of all these apps today. The climate app, the goal of the climate app is to import weather and climate data, both global and local. We are starting with global data, and the same techniques of how we are harmonizing this data with the health data also applied to the CHAP platform. So all of this is linked together. Next. So these are some example plots from this climate app. It's really easy to get started with this app. It's just to go on our app hub and install it. You need DHIS 237 and above to use it. And then there are 2 important requirements. One is that you need to have access to Google Earth Engine, and that is something we can help with. I know a lot of you already have access. Within this year, there has been 50 organizations signing up for Google Earth Engine. Also important to note that this Google Earth Engine access is available for free, but only for non-commercial use. So this is available for non-profit organizations. If you are a profit organization for profit, you would need to ask for permission directly from the Google Earth Engine team. We are including, and then the other requirement is that you also need to have coordinates for your organization units and districts, because this is how we are able to harmonize the data. So we need to know where the health facility is to be able to get climate data for that location. We are including different data sources. So the most important data source we have is ERA5 land, and the plots to the right is from this data set. I will soon show you some other data sets that we have added this autumn. And this is an ongoing project. So based on demand from our users, we would like to include more data, both local and global and regional data into this app. Just a little bit about the plots. These are a few examples for a district, Chitwan district in Nepal, the lowlands. You can see there was severe floods occurring in September. So you can see the top left that the rainfall in September was 3 times more than the normal from this ERA5 dataset. Next to the right is relative humidity. We have daily temperatures, and you can also see the warming trend, the temperature anomalies for this district, and you can see especially how warm the last 2 years has been compared to the previous years. Yeah, and also we launched this app in April, and it's been 3,000 installations, and one installation can be used by several users. So we see that a lot of people have been testing out this app and also giving us feedback. So please continue to do that. Next. This is how we are harmonizing the climate data. This ERA5 land dataset is a so-called gridded dataset. So for every 9 by 9 kilometers, we have, for example, a temperature value. So then we use the boundary of the district and see what of these grid cells that falls within, and then take the average to calculate the value for that district. So this is how we do spatially for all the regions. For a period, we import daily values from this data, and then we use the built-in aggregation tools in DHIS2 to aggregate up to the health period types that you have. So if you operate on weekly data, you can aggregate up to weekly or monthly or any period type you have in your system. Next. This is brand new. We actually launched a new version of the app today, version 1.5. We have gotten some feedback that the precipitation data in ERA5 land is not always accurate, especially in areas where there are few ground stations. So there is another data set for precipitation, which is called CHIRPS, which has proven to be better in these areas. So if you go in to use the app to import data, you have 2 options for precipitation, one from ERA5 land and the other is this CHIRPS dataset. Another benefit with this data is that this has a much better resolution. It's 4 to 5 kilometers compared to the 9 kilometers ERA5. It means that we have 4 times more grid cells. So you can see on the right on the map the level of details we have to the CHIRPS at the bottom compared to ERA5. You can also see that this is actually showing the same month of September, and you can see it gives you a different picture of the amount of rainfall. So even though we now make it super easy for you to include climate data, you always have to keep questioning the data, and we always need to strive to get the best climate and weather data available into our system. Next. So here I imported both the CHIRPS and the ERA5 data into DHIS2, and then of course you can use the data visualizer to compare them. So I took 1 month, May this year, and then took all the districts in Sierra Leone. So you can see how the 2 different data sets differs. Some of the districts they are quite equal, while others generally this CHIRPS data set perceives or measures more rainfall than the ERA5, which often proves to be more correct. And then to the right, the other one, it shows more the change from one district from 1 month to the other. So you can see that the trend is similar, but there are some changes between the 2 data sources. So which one should you use? I would often start checking if there is any local weather data available that you could use. And also use the National Met Office. They are the experts in the country to ask for advice. I see there is a lot of research papers for different countries comparing these 2 data sets. So just make a search and see which one is performing better for your countries. And then I think the great thing with our platform is that we can actually use both. So when we have the models and make the predictions, we can feed in both data sets and we can see which actually gives us the best predictions. Also, just to mention that, especially for precipitation, it's better to look at the seasonality and monthly data rather than the daily data. The daily data is less reliable than when you look for longer periods. For temperature, it's a different story. The temperature is much more accurate compared to the station where we measure. Next. This is also new this autumn. We already had data on temperature, but air temperature is not enough when we are measuring heat waves, because there are other factors that are important, and we need to look at the felt temperature and not the air temperature. So that's why we have included this heat stress data. It's based on something called the Universal Thermal Climate Index, and that also takes in addition to air temperature, it also takes humidity, wind speed, and radiation into account. So this again in Nepal, we have in the pilot we have looking at 4 different regions from the lowland to the mountains. And there is a big elevation change, and you can, for example, make this plot in the climate app and then compare the different districts. And you will see the heat waves have been an increasing problem in Nepal, and especially in the 2 top, the lowland and the hill. You will see that there are daytime temperature that goes into the about 38 degrees. They had to close a lot of schools in July this year because of this heat wave. One limitation of this dataset is that it's only 30-kilometer resolution, and of course there will be big variations between, and especially within urban areas where the temperature can often be 5 to 10 degrees warmer than this. So we need more granular, more detailed data, and one future dataset could be this Global Heat Resilience Service that aims to produce global available data for all city areas. So we try to build an open platform and where we can incorporate new data sets as they become available. Next. So important here, like we have learned that we need more detailed data, we need more local data. These global data sets will give you a good start, and especially with the modeling, I think that will be very useful. But we also need to chase and for the local data and make these integrations. So, but I will just start to mention that even with the global data sets, there are data from the individual weather stations included, but only these automatic weather stations that automatically report data to the global community through the WMO. And this is then the pipeline we can access data through Google Earth Engine. Also, this goes by itself. There are workflows, so as long as new data is coming in automatically, it will also be available for you in the climate app. You don't need to download any new data. It will instantly become available in the climate app. But then we also need to get access to more local weather stations. And luckily, we have made agreements in at least 9 out of the 10 countries. We have agreements between the health ministry and the Met Office to allow this data sharing. And then we have 2 initiatives. There is something called the IRI, International Research Institute of Society and Health, or Climate of Society. This is from Columbia University. And they are trying to take the best of both worlds. They are trying to get access to as much local data as possible, but then to use global data to fill in the gaps where there are missing data, and then produce this grid data set that we can then import into DHIS2. And we now have a cooperation with them, so they are going to work on an API access to their platform so we can get this data. And we are also looking at how we can include the weather station data directly into DHIS2. This is unfortunately quite a technical challenge to go from a weather station to a health district. But we are looking at some solutions there. Also, if you have worked on this, please reach out, because we would like to have share some experience on how to do this. Next. Also in Nepal, they have shown interest in not only using climate and weather data for modeling, but also additional data that will help us to predict. Of course, there is a strong correlation between climate factors and also change of land use, deforestation, and so on. So we are looking into other data sets to include. There is also the challenge with Nepal is that even though within these 9 by 9 kilometer areas, there are huge variations in elevation. So we need to take more data into account to be able to make good predictions. We also have a cooperation for a long time from WorldPop to include data on population data that might help us to show vulnerable populations within the health districts. And there is a new data set coming by the end of the year that we will include. which shows population data and also projections from 2015 to 2030 at 100 by 100 meter resolution. So very high resolution. NASA has also been approaching us. They would like to make an integration between their API and DHIS2. They have some interesting data sets, especially on land use. And I could also mention that Esri, the biggest commercial provider of GIS software, has made a connector. So you can export data from DHIS2 into the ArcGIS Esri platform and then use their range of tools that they have. Yes. Next. We have made there has been a lot of interest on air pollution from the countries. You can see on the global map, this is something called OpenAQ that includes data from these devices all over the world showing the air pollution. And we are making an integration with this, but you can see there are big data gaps especially in Africa. So there are also some local initiatives like the AirQO, which HISP Uganda is working with, and the map to the right is the weather station they have put up and also showing the conditions in the city of Kampala. And then we are also having a project with CISRO here in Oslo, which are using modeling to combine both local and global data to make this gridded data set comparing air pollution and also heat at the 1 kilometer resolution. So we are trying different approaches here to get hold of this data. Again, please reach out for us if you know of interesting data set that would be interesting to include. I will hand over to Patrick.
Yes, thank you so much, Bjorn. So once we had the first tool, and that was the climate app, we are then set to do pilots in countries. And as you can see, we've been focusing on 10 countries. But as Bjorn already mentioned, we know that many countries could have already downloaded the app. But for this country, the 10 countries, we are keen to understand whether they have been able to have a data sharing agreement in place, whether they are able to install the app and import some data, but also these countries, we are keen to make sure that we're able to set this modeling platform on. And as you can see for the data sharing agreement, 9 of the countries at least have some agreement in place. And this is very, very important for us to ensure that we have this working arrangement between Ministry of Health and the meteorology office. That's very important. And for the climate app, you can see we have 4 countries have already gone ahead to put this into production, and they have gone ahead to start exploring data. While for the others, they are putting into their test or what we call development instance, and in a way they still use that to explore this data. But specifically for modeling, we have 4 countries that have already started stages of setting this up, and you can see Rwanda, Togo, Uganda, and Laos. So these countries, they've gone ahead to start testing the models. They've been able to already do some, assessment of the models, and in the next few days or few weeks, we should be able to have this up and running in these countries. Again, for these countries, these are some of the areas that have piqued interest in. As you can see, most of them are really focusing on malaria, especially the ones in Africa. But for Asia, the focus has been more into the dengue. But there have also been other areas of interest. We also note that countries have also gone ahead to set up this app and do some exploration without necessarily being part of these 10 pilot countries, which again speaks to the easiness of being able to use this tool once it's available. You can see Ghana, Indonesia, Maldives, and all these other countries have been able to go ahead and set up the app and start to explore data, including Madagascar that has been also doing some work around this. Next slide. So, once we set up the app, the challenge has been really, how do we start analyzing this data? And this is an example of how, if you just look at temperature data and temperature data and then health data, and you start to use the core DHIS2 or the visualization tools that we have, these are the kind of things that you would end up with, where you are simply, you know, doing more like a dual chart that's able to help you compare your health data and climate data. And you could see something, but maybe it may not speak much and may not be so helpful if you are really to try and use this to make a decision that is sound. But this is what we've so far started with, just for exploring data. And this is really the reason why we are now looking forward to the part of modeling and prediction that we are going to speak to shortly. But this has, in a way, been good enough for you to take a look at what's happening, but maybe not good enough for you to make a much more sound decision. So I'll hand over to the modeling team to take us through how they've taken this from importing this data, us trying to explore the analysis using, you know, the core tools that we have within the DHIS2 into now modeling and prediction. Over to you, Gashet.
Yes, thank you, Patrick. Yes, I think like the main challenge here is that we can see, as Patrick said, like the dengue cases in blue here, they are a bit seasonal. There are some years where it's a bit low, which is these COVID years, maybe because of reduced mobility, maybe because of data quality issues. They should probably be removed. The rain, which is the rainfall, which is the red one here, follows the same kind of season, but it's a bit hard from these to see, like, to what degree is it really the rainfall and the season of the, is it the rainfall itself that influences dengue, or is it more the season that both the rainfall and dengue follows? So for that reason, we believe it will be very useful to go over to modeling tools, because it's quite hard to see by eye. And this is the reason we have made this CHAP platform, which includes all the data harmonization, all the data access that Björn and Patrick had talked about, and also includes and combines this with modeling. And we have set this up as a very community-driven open source project. So the way we see it is that we here at in the HISP, we help with the coordination of this project, but we want like community input, both in the HISP network and beyond the HISP network. Innovations for countries flowing through, which we will discuss more, and a lot of different actors. And it's basically two things. One thing is the CHAP platform, which is more of an umbrella for models. So CHAP itself is not a model. It's not one specific way of learning to forecast ahead in time. It's just an umbrella or an ecosystem that allows a lot of different models to be used by countries. So it helps get the data in, harmonize the data, run models, install models, assess how well the models work, all of these kind of things. But the models themselves are in kind of a external pool, so we can in principle use any kind of model out there, and we'll come back to this. And this is like very simplified way of what does modeling really mean. It means essentially that we're taking the climate data, we take in the health data, then we try to learn and estimate some parameters of a mathematical formula that connects climate and health, and also connects health and disease over time. So you would learn how like precipitation or temperature influences something like dengue, and to see like what temperature ranges are optimal for dengue and which are less optimal for dengue. And then there could be a lot of different ways to model this, to make a mathematical or machine learning model of it. And we want then all of these to come together. And then in the end, you end up with something like this. This is a map of Vietnam with different regions. And then you can easily see like which regions, for instance, are in January expected to have a high number of dengue cases. This is not our work, so we just want to show how we integrate work from the literature in this platform. So this is a brief explanation of like what does machine learning mean in this setting. So it's basically that this orange thing here is, for instance, malaria cases. This is just a stylized thing to explain. So this could be malaria cases. The gray could be rainfall in the different months. And then we observe all of this until July. And then we are in July and want to say something about what we believe will happen ahead. And as you see, since this seems to be following some pattern, we believe it will follow a pattern. And the light blue here is also telling us that, okay, we cannot really know how it will develop. We are quite uncertain. So it could go all the way up here or all the way down there. And of course, this is a very stylized view, and actually, indeed, in this case, it seems that rainfall is, in this example, it's not even influencing it. It's just following a very simple pattern. But the idea here is to see how a lot of different types of data, which could be temperature, rainfall, but also things like vegetation index and so on, could influence the development in many different regions. And learning the local part of this is something we're particularly focused on now. So how do these diseases develop across time and seasons? What is the relation between the climate and disease? Make these uncertain forecasts ahead, but also learn how the different regions relate. So different neighboring regions will probably be influenced similarly, so we can kind of borrow information across regions, and that is also an important part. And then, since we are in HISP and we have decades of experience from the DHIS2 system, we know that the prediction model, like a machine learning model to forecast dengue cases, malaria cases, something like that in the month ahead, it needs to match the local context, meaning that it needs to be different in each local context, like a country or even a region. But at the same time, there are not resources to develop it from scratch each place. That is not a good resource use. So instead, what we say is that we need a long-lived, reusable generic platform, as Christian said at the beginning, and where we design this from the start, and this we have put a lot of effort into, how can we design this system so it's easy to tailor to local contexts? So it's not just like we develop it from one country and then we try to make it work for the second. It's more that we try to make a system that from the outset is meant to be very efficient to customize. And importantly also then, all the innovation, I think a lot of the innovations will come from the local exploration of this. And then we also focus on how these local innovations can now flow back to the platform so that innovations in one country can be reused by another one. And we also need to consider the socio-technical perspective to this, which has a long track record within the digitalization of normally IT systems, but it's in our impression, it's not so often considered for AI development or machine learning and modeling. But to us, it's exactly the same. So what CHAP aims to do is a system that is designed to be tailored to needs. It's also a system that has a lot of functionality for what we call evidence building, meaning that if a country implements one of these models or alternative models, they should be able to go back in time, pretend that they didn't know what happened, run these models, and then see how well it works. And I'll show some examples of this. And the third thing here is also to put it in operation. So you could start by a bit exploration and feasibility studies, and then you should kind of a bit seamlessly go over to have it being run weekly with all the data back in DHIS2 so that it can be put into use. And a bit technically, these are the main components. It's the data input that Björn talked about. Like what kind of data sources do we get from local climate sources, DHIS2 system, ERA 5, and so on. Then it's the data harmonization that also Björn talked about, which is how do we get the climate data aligned with the health data. It's the model streamlining where, as I mentioned, we can have like tens of models from the international academic literature or from different projects being unified in one platform. And then it's this historic assessment that I just talked about. And finally, there is this what I have called brokering, which is to say that if we have all these models and all these functionalities in place, how can you easily in a country find the models and the types of data that are most useful for you? So finally, how is it developed? Well, we are very focused, being in HISP, in meeting the real needs, that we actually work on the ground, that we work with countries, that we solve concrete problems from the start. And at the same time, we are ready for reuse. We do it as short iterations. So this is a very early iteration that I'll soon demo today. But we also have these long-term ambitions, and we hope to develop this for decades to come. We have the statistical models, the cutting-edge machine learning that Christian mentioned in the beginning, but also this robust software implementation. So it should be bug-free, and it should be really tested that we can trust it. And as we've seen before, it's developed in close collaboration with pilot countries and other interests. For those into DHIS2, this is also a bit more details about how it actually works. We are streamlining the installation, configuration, and use in the countries, and also the comparison of models. And we have the climate app that Björn talked about that gets in the climate data. Then we have the prediction app that I'll soon show, which kind of sets up this whole modeling effort. And what happens when you set up the modeling is that the data flows now out from DHIS2 system into this CHAP core platform, where we are training a machine learning model based on the historic data. So when this model has been trained, it flows back again or is stored in the system available to DHIS2, so that afterwards you can take that model that is now trained based on the country data, and you can put in the newest data to it, like every week you can put in new data, and then make the predictions for the month ahead. Then the data flows back again to DHIS2 from the CHAP system, and it flows in as a standard data element in DHIS2, meaning that you can use any functionality you have in DHIS2, like the Maps app, the data visualizations, dashboards, and so on. And we also have, as I said, we see CHAP as a platform to integrate a lot of what is already available, have the data access, the assessment, and also the connection to DHIS2. So that is what CHAP delivers. And then one thing we have concretely started working on already is the EVARS Plus or the EVARS CSD from the World Health Organization, which is a popular model, and we have now integrated it with CHAP, so that countries that have CHAP connected to their DHIS2 system can then, from the DHIS2 system, connect to CHAP, connect further to EVARS Plus, train models in EVARS Plus, make forecasts with EVARS Plus, get the data back to CHAP and back to DHIS2. So this is one of the models that we have worked on. This is just to show very briefly, as I mentioned, that what we basically want to do here, we cannot predict with certainty how malaria or dengue or something else will develop. So what we will do is to say, we believe the most likely trajectory forward is this darkest blue, but we also see that with some probability, it could be in this entire range. And in assessment, what you're typically doing, so this is based data from Laos, you can make the predictions, and then you can afterwards, so you kind of pretend that you only knew the data up here, you make the predictions, and then you will afterwards see how it compares. So now you can see the orange is the truth as it unraveled, while the blue is what the model predicted when it only seen data up to a given point. So I'll try to show some demos. And that is always risky, but bear with me. So this is the public webpage for CHAP. It's available from the DHIS2 climate page also. Here we want to share everything openly with the community. So from here you can find the code base, you can find our development plans, you can even go to our to-do lists for what we are working on in the weeks ahead. We have ideas for academic literature, the motivation for it, and all of it. And one thing we have now is then this CHAP Core, which is this platform software. And we also have CHAP Dashboard, which is more the front-end side for those that are more interested in that. We have tutorials now on how to develop your own model and integrate it into CHAP. So this is what basically the path we have followed with a WHO EVAR system, but also we can do it with others. And this is explaining in quite detail how you can set it up on your own laptop, try it out, a bit of suggested simple code that you could write, how you can now connect it to CHAP, which is again a quite simple YAML file that just tells CHAP how you want to run the model that you have developed. And after you have done that, you can harmonize and create your data. And then you can also evaluate it here using CHAP Evaluate, which is this downloadable chat platform tool that you can have on your laptop, on a virtual machine, on the cloud, wherever you want. And just to show what this means, it's like is that I download here just locally the CHAP. You install it with pip install in Python. And then I write something like CHAP evaluate model name. And here I can put in any kind of GitHub repository that defines its interface for use by CHAP. So this can be something external that you develop yourself. And anyone, if you have developed something and put it out on GitHub, then anyone that have CHAP can try to run your code here on one of the data sets that are inside the system or other data with what kind of country. And when we run this now, it will run on the laptop. It will create a lot of files and so on and train the models and do the forecasts. It will end up with something like these two files, which are just like the predictions from, in this case, we have run it for 2 different models. Now you can go to this app, and I can now say that I now want to explore the predictions made by this WHO EVARS model, for instance.
For Laos.
For Laos. This. So I select this one. I select also another method just to have 2 to compare. And now you can see here that you get up all the predictions for all the different regions. So we can now go down to, for instance, the capital. And now you can see from here that, like, okay, this was the historic data going a bit up and down. And then you can also zoom in to the last region. And you can see, like, this is what really happened. And the blue one is what the model predicted. And now we can see side by side that we have 2 different models that gave 2 different predictions. And now we can then go back and explore this for a lot of different regions in Laos. And you can also say, okay, now I pretended to be at this time point. I can also pretend to be in a different time point, like at week 27, to be more recent and see, like, how would the forecast have changed if I had a bit more of the data available. Finally, I also wanted to show briefly this prediction app, how that works. So that is an app that you install in the DHIS2 system. So I'm just showing you a demo how it works. It has the 2 different parts, predictions and visualizations that are on the way. In this example, I'm just using some demo fictional data for Rwanda. And basically what you do in this app is first to select what model, for instance, the CHAP EVARS that I mentioned. This is a model to train and use. Then you select what data elements you want to use from DHIS2 for the population and the disease cases. In this case, we select malaria. Then you select which climate data source you use. And as default, we use the ERA5 that Björn have presented. Then you select the organization units, which parts of the country, and at what level, like here, district. Then you say what you want to train on, the historic data, which years do you trust the data quality for. And after having selected the years you want to use, then you click the send data to CHAP. So now the prediction app will start the same thing that I showed on my laptop. It's doing the training, the prediction, and after a little while it should be ready. And you can import this one now back to the prediction apps and back to DHIS2. So this is what you see. It's similar to what I showed. It's the uncertainty. You can go in and see what are kind of the predictions for October and for November and so on, and read off the numbers. And you can also go down and you can import it back into particular data elements in DHIS2. If you haven't made those yet, you can also click the data elements and you see our suggested ways of exactly which data elements to add to the DHIS2 system. And inside then there's a range of different visualization tools and dashboards that you can use as much. So what makes good predictions? Well, I think this is something that we want to learn more about and are interested in discussing, but there should be strong connections between climate and the disease one is studying that will make it kind of more informative. Of course, the quality of all the type of data that goes in, both the health data and the climate data. And finally, the quality of the model. And this is why we want to have like at least 10 models to select between, so that you can choose what works best for your country. Then you should consider what data sources you can use, that the data is complete, evaluate climate sources, like Björn said, stress test the different models, and also, importantly, understand the decision support needs in fine detail. So how long do you actually need to know it? What uncertainty is appropriate for you? What kind of errors can you live with, and what are more are worse? So for countries that I hope I've showed also through this, it's like the advantage and the benefit is that you have streamlined installation. We are working a lot now on the LXD containers and so on, that a lot of countries are already using. That the data harmonization comes out of the box. You connect these models directly to the data in DHIS2. You can do these quick feasibility assessments and get the forecasts back, like the predictions ahead in time, back into the DHIS2 system, where any DHIS2 system user in the country can see it. It provides a lot of generic software that can be reused. It's also, importantly, as Christian said, a learning platform. And I think that is really important. And also it connects countries with each other and the international modeling community. Because since this is a platform that have 10 models, then the country can make their version. They can test it side by side with, against other models, and then they can come back to the international community and say, like, for our context and our questions, we found a version of a model that worked actually better. And for modeling partners, they can have all these kind of generic software components that they don't need to develop from scratch every time. They can reuse robust, well-tested components. And we are already discussing this with PivotWorks, for instance, in Madagascar, Ciencia Vida in Latin America, WHO EVARS in Barcelona, a supercomputing center. And it also means that if you have a good model and you see that it works better than other models on relevant data, you can easily disseminate it out to the countries. And there's a lot of opportunities to get involved in this. As I said, we want this to be an open community where there are innovations flowing in from everyone interested. We want to generate predictions. We understand how they are used. There's a lot on coding that can be done, but there's also a lot on subject matter expertise, engagement with country programs, understanding these at the fine level decision needs. The HISP groups are working together with the Minister of Health in many countries. And I think there is a long process in this kind of really finding out what are the best ways to communicate the predictions, but also what kind of predictions are the most relevant ones. So we want to connect with existing programs, with existing research projects, and any kind of initiatives to find potential synergies. And a major motivation for us is to avoid duplicated efforts. So we really hope that everyone that does anything of relevance here want to come together, contribute to this, which is open source from the start, so that we can all join efforts. And we have funding from Wellcome to bring at least we hope to be able to bring it to some use cases in some countries to scale, but we are also working actively to try to get more funding to be able to operate in more countries. So to conclude, I think our strong encouragement is for us as a community and all of you that are here, to come together to develop generic solutions as a community where we have local innovations, but they have a broad generic global reach. We are happy to contribute and help to coordinate it, where all we do is share openly. And we hope that the CHAP platform can be an umbrella for models so that you can really see which models are best, and that a lot of people get the motivation to try to make their own model and see if they can find some use cases where it works better. It integrates optionally. It can be run standalone, but it's also really powerful when it's integrated with DHIS2. And finally, I just want to say, please join this effort and join our community, because the challenge we have ahead is so vast that all the hands are needed to pull this together. And I'll just end with these links. This is the main CHAP homepage where you find all the information. We have a mailing list you can sign up to, and also an overview of the entire climate project.
Thank you, Kjetil. Thank you, team. We have tremendously a lot of questions in the chat. I also want to say that the chat at DHIS2.org can also be, you can be in contact on that way as well. Anyone that want to do I see that you have responded to quite a lot of the questions already. So there are some questions as a summary. Are there any specific process for countries to start using the CHAP or be part of the pilot process?
Yes, and I can also show actually here in this. So this is the link that you could follow, and you come to this page. And then we have a section about like, please join us. And to say that there are several options you can do. I think one thing that could be interesting for many is to try to follow these tutorials on developing custom models. And that you can do quite independently. You can make it work based on these tutorials. You can make your own complex model if you're interested. And then, as I showed here, you can just put it out on GitHub, and then you can just try to get anyone to run it. I think another way to contribute that is also good is that like all of these things with assessment and visualization, there are like dozens of different ways of visualizing that will be good in different contexts and different ways of assessing. Is it like how close you are in the number of cases? Is it whether you hit the outbreaks, the real dramatic outbreaks? So I think there's a lot of different ways to do that, and all contributions and ideas on this will be highly welcome. And we want to have kind of a big catalog of ways to do this so that the country can not have one solution, but choose between a lot of proposed solutions. And finally, we have now focused mostly on dengue and malaria in our work because of our limited resources, but everything related to other waterborne diseases like cholera, but also for nutrition maybe, heat stress, maternal health. So there's a lot of different health impacts where a similar approach and where software reuse could be central.
So that answered the next question also that I wanted to speak up to, is that whether we are restricted to specific health conditions, but we are not, or diseases, because this is exploratory. There are so many unknown. We started with the kind of where we felt it was like low-hanging fruit, meaning easy to show the impact on dengue, malaria. Then we started there, but we go to whatever disease that we see that are vulnerable to climate changes, and to see whether we can be able to support the health program with better decisions. So this is where the research is coming in, that we do exploratory research, meaning actual research in countries with the health programs in order to understand better. So it's for us, it's very important to engage the national health programs and see what kind of type of decisions can be supported by better predictions.
And we could mention that since we are connecting to general data elements in DHIS2, it should be all the functionality and the core stuff should be very easy to kind of change if you have a good modeling idea for one particular health tip.
There's another question here. Does CHAP have an automatic mechanism for selecting the best model for predicting events, or is it a manual selection process?
Yeah, that's also a very good question. So this is something we are currently working on. We are trying this AutoML approach, where we set up that the models have a lot of parameters or hyperparameters that can be tuned. And then we want to have an objective way of selecting among them. And this is in the works now. And but it's something that we also want to have more collaborations on, because there are many ways of doing it, and for different models. So that is something of high interest.
So connecting to the modeling, are you taking into account, another good question, the interventions during that prediction?
Yes, this is a good question. We have discussed it. So the PivotWorks in Madagascar have worked on this. We have discussed it with them. We haven't done it yet in those examples we showed here, but that is certainly something we want to have in soon, because we believe it's really important. And we could mention that we are also interested there a bit in the causal interpretation of this, because now we see the patterns, but maybe there are seasonal interventions that actually affect this picture. And we want to say, what would have happened if you didn't do that malaria intervention, for instance? So that is also something we want to explore, but we haven't got into that yet.
So going back again to, are there any processes, to start up with CHAP and do these predictions? It's of course please connect the closest HISP group, because we are always working with this capacity building through the HISP groups as our network. Of course, other groups are very much welcome as well. Another CHAP question, can CHAP accommodate R codes?
Yes. So in these examples, I've shown it with Python, but we also have support for R code, and this WHO EVARS is R code. Then we do that with the system based on Docker, and we also have a separate tutorial on how to actually incorporate an R code into this system. And in principle, it's also possible to make in other languages, as long as people show this, provide this YAML file here, which is actually based on what is called MLflow. So it's kind of a generic solution for any kind of language.
And then the questions about short-term projections. Is this weeks or months?
Yeah, so it seems that a lot of people in the field have mostly looked at 3 months ahead, up to 3 months ahead. And this we are also looking into, how far can you really go ahead and still have a bit meaningful prediction, not too much uncertainty. And we are looking into seasonal forecasts, but we haven't really put them in yet. So that is also interesting to see how far can we go. We have not looked into something like 10-year, like what will happen in 10 years with malaria in the country, but these with climate change and more of a decade perspective could also be interesting. And we think a lot of the components could be reused for that purpose.
Then we have the questions on where did we the last one here? Any use case available to assist with using CHAP? If we don't, if users wanting to find out more info on pediatrics, emergency response, nutrition, according to their role, upskin, etc.
Yeah, that is something that's a good point. We haven't put out so much about that yet, but that we can do actually, and together with the community, because everything we do here, we do it as GitHub requests. So whenever people have a good idea, please contact us. And like, I think something like this would be great to have. We try to put out a lot. We have based on the competence we have, but we are very open to ideas.
There's one here I think we skipped. Can you build custom models that are context specific for disease prediction?
Yeah, you can make it very custom inside these models. And since the system allows you to select one, we are kind of hoping to have a lot of very specific tailored models.
What have we done for floods? That was the last one, I think, probably.
Yeah, we have not done so much on floods. There are interest from the countries, and we are looking into some of the global data sets showing flood areas and vulnerable population along rivers and so on. But for the modeling part, we have not really started to look into this.
And we have also discussed it in connection with logistics, but not really started with that.
But if you have ideas of how this could be, how we could work with flood data, please reach out to us.
So there's the last question.
Yeah, we have to. So the way it works now is that you have to train it on the same type of data sources. So that you have had before. Yeah. So the question is, how do you handle features on which it was not trained on before? So the way this works is that if you have historic data and you train a model based on, for instance, only temperature and rain, and then you also get humidity data, then what you would do is that you come now have the same process, but you add in humidity data, and then you train the model again based on the historic data. So you retrain based on historic data for everything you have available, and then you start forecasting with that new model.
And the more data, the merrier, huh?
Yeah, usually the more data, the merrier. As long as the quality is decent, it should always help. Yeah.
Okay, I think if we don't have more questions that are not attended to, I really think this has been a good Q&A as well. Thank you everyone that presenting. Please contact us for either on the email, sign up for the mailing list, or contact us in one way or another. So there will be more webinars to come, I guess, when we have developed more features and more knowledge around the implementation. We are in the beginning. We started 1st of March, but this is the first one for the CHAP. But the climate app we have presented many times actually. But we have new release today that we are very proud of. Okay, thank you very much everyone that attended this webinar. I think we are good to go to close this webinar. Thank you so much.